Welcome back to my YouTube channel, The BDS Graduate. So today I am discussing in detail about the intracanal medicaments. Okay, it comes under the subject of endodontics. It is a final year student subject. Okay, so the intracanal medicaments, these are used during the root canal procedure. Why we are using this intracanal medicaments? In generally, we done the root canal procedure if the infection it reaches the pulp. So there is a infection, right? How we control this infection? By using this intracanal medicaments. So we need to remove the infection. So that is a disinfection of pulpal space, which is an important step because it is a part of a controlled asepsis in case of infected root canal. And there are many types of root canal medicaments are there. But what are the ideal requirements of this intracanal medicaments? So the first ideal requirement is it must be effective antimicrobial agent, and it is remains stable during the solution stage, and it should have a prolonged antimicrobial effect, and it have a low surface tension, and it should not interfere with the repair of the periradicular tissue, so it does not affect the surrounding tissue, and it should not stain the tooth surface also. Okay, and it should be active even in the presence of blood, serum and the protein like pus areas. Coming to its indication, so the first indication is why we are using this: to dry the wet canals, nothing but weeping canals, and to eliminate the any remaining microbes are present in case of the pulp. And it acts as a barrier against the leakage from interappointmental dressings in case of symptomatic cases. So the mainly today we are discussing about the these four. One is calcium hydroxide, and the CHX means chlorhexidine, and the third one is antibiotics. Those are two types. One is triple antibiotic paste and the second one is double antibiotic paste, and the fourth one is the steroids. So coming to first one, this is a calcium hydroxide. So coming to this, the calcium hydroxide. So the first calcium hydroxide, it was introduced by Herman. Sorry for the disturbance. So the releasing of these hydroxyl ions, I'm discussing now about this mechanism of action, right? So the release of these hydroxyl ions, which is in the aqueous environment, these hydroxyl ions from this were calcium hydroxide. So these hydroxyl ions are releasing. So these are highly oxidizing free radicals. What the function of these free radicals? They destroy the bacteria. So the free radicals which are releasing from the calcium hydroxide, that are hydroxyl ions, so they destroy the bacteria also. And how it destroying the bacteria? By damaging the bacterial cytoplasmic membrane and the protein denaturation, and the damaging the bacterial DNA also. So the bacterial surrounding cell membrane, this is a bacterial cell membrane, right? And the central part of the DNA. So the calcium hydroxide main mechanism of action is it destroy the bacteria or the infectious organisms by the cytoplasmic membrane or by the denaturation of the proteins and as well as DNA. This is a mechanism of calcium hydroxide. So the pH is alkaline nature, like 12.5. And coming to the second one, this is a chlorhexidine, right? So it acts as a both the intracanal medicament and as well as root canal irrigant, and it can be used as a 2% of chlorhexidine gel, which is used as an intracanal medicament, or it can be used in a combination of CHX chlorhexidine with the calcium hydroxide also. And the third one is the antibiotics. The antibiotics, it plays a limited role. Why it plays in the limited role means these are the bacteriostatic, so they prevent the growth of microorganisms without killing them. That's why they are limited role. And as the infected root canal space has a no blood supply, so there is no blood supply, so the effect of these antibiotics are also limited. These are the reasons for the limited use of these intracanal medicaments. Mainly we use the calcium hydroxide and then chlorhexidine. So the antibiotics, right? There are two types. One is triple antibiotic and then double antibiotic. It is very important. So what is triple antibiotic means? The combination of these three drugs in the presence of propylene glycol vehicle. So these are taken in the ratio of 1:1:1. One is ciprofloxacin and metronidazole and then minocycline. You have to by heart these names, okay? So that is a triple antibiotic name, and this is a double antibiotic. What is double antibiotic paste? Only the ciprofloxacin and then metronidazole. In case of triple antibiotic, there is no minocycline is present. Minocycline in the case of triple antibiotic case, which is absent in the case of double antibiotic paste. And the final one is steroids. These are used as a internal resorption and as well as traumatic injuries of the teeth. The main drug of the steroid, that is a leader mix. The composition is, one is corticosteroid and then antibiotic. The corticosteroid is 1% of triamcinolone acetonide, and the next one is the antibiotic, that is a demiclocycline. So this is about the intracanal medicaments. Okay, the mainly the definition and the ideal requirements, the indications and the materials which are using the intracanal medicaments, and you have to explain each of everyone. Thank you for watching. Please do subscribe for more videos.